Hello, Facebook. It's Jill Mitchell, Doctor of Physical Therapy and owner of Thrive Physio and Wellness, which is a mobile concierge PT practice here in Dallas, Texas. I hope everyone is having a great week. It is Wellness Wednesday. It happens every Wednesday where I talk about various topics, either physical therapy / exercise related, or if you haven't noticed, I switch off weeks with just general health and wellness topics. I hope you can't hear Rocky chewing on his chewy, but I apologize if you can. So today's topic is a health and wellness topic. The question was, what is the most common type of cancer? Hi Trisha, hi Eric, thank you guys so much for watching. And then the other thing that I mentioned in my post was that this is a personal topic for me. So today's discussion or spiel is not just kind of about it is a type of cancer, but it's a lesson in that, but it also is a personal story. And just learning a little bit more about me, and kind of explains why I am the way that I am. So anyway, on with the show. So the most common type of cancer is skin cancer. And so I think Steve is the one that got it right. So hey Courtney, thank you for watching. So 1 in 5 Americans will experience skin cancer at some point in their lifetime. Some other interesting statistics about skin cancer are that there are approximately 9,500 diagnoses of skin cancer in a day, and then more than 2 people die from skin cancer every hour. So definitely a topic that's worth talking about. So we're just gonna get started. And so I'm gonna start with the different types of skin cancer. There are basically 3 main types. And just one thing to know about when we're talking about cancer is, cancer is an abnormal growth of cells in your body that's uncontrolled. It's gone out of control. So when we're talking about types of not just skin cancer, it is all based on the cell that originates that abnormal growth. So I'm going to talk about 3 types. It starts with the most common, but it all has to do with the original cell. So the first type is basal cell carcinoma. So it's originating in a basal cell. So one thing to know about your skin is it replenishes its cells and replaces itself every 28 days. And so a basal cell is responsible for that cellular replacement, like producing the new cells. So if you think about it logically, that's kind of an area that would be a common problem. Like it's developed this abnormality with its replenishing of cells. So that is the most common type. The second category is squamous cell carcinoma, which is in another type of cell that's in your epidermis. And so that's the second most common type. And then the third type, which is the most severe, the most concerning type, is a melanoma. And a melanoma originates in your melanocytes, which are the cells in your skin that are responsible for producing the pigment or the melanin that gives your skin its color. So when you're tanning, if you have darker skin, it is your melanocytes that are responsible for that. And so that's the most, thanks for sharing, Courtney. I would really like for you to keep in touch with me and let me know how that goes. Hi Mom, thanks for watching. So sorry, I'm getting off track. One thing to know is that skin cancer can affect anyone of any color, any race. One thing that is interesting to know though is people of color are typically diagnosed at a later stage. And that obviously in a later stage is harder to treat. So why that is, that would definitely be something worth investigating more. And then when I mentioned stages, so when we're talking about stages of cancer, it's basically 0 to 4. 0 technically is not a cancer, it's just an abnormal, it's noted that you have abnormal cell growth. It's not actually classified as cancer at that stage. Oftentimes the word or words in situ is used. So then you move on to stage 1, which basically is it's in that cell. It's noted to have abnormal cell growth. That's stage 1. That's an early stage. That's where you want to catch it. And then you're moving into stage 2 to 3 is when it increases in size and it may have also traveled to your lymph nodes. And then stage 4 is a more advanced stage, sometimes using the term metastatic, which means it's traveled to other areas of your body. And obviously the later stages that you catch it, that's not when you want to catch it. So a couple of more statistics. So going back to the types of skin cancer, basically even though there's 3 main types, they do kind of classify them as melanoma as one category and then non-melanoma as the other category. So the basal cell and the squamous cell kind of fall in those same categories. So just a few more interesting statistics. For non-melanoma skin cancer, approximately 3 million Americans are dealing with this within a year's time. And then for a melanoma, approximately 1 million Americans are dealing with this. One statistic, if you can't tell, I think statistics are interesting. But between the year of 1982 to 2011, melanoma rates doubled and they continue to increase. So I just think that is definitely interesting, especially if you think about that we try to be more diligent about sunscreen and we're more aware of these things. So why is it rising? So just a topic to consider.